Check the link. We're just getting ready for live stream. 2 minutes. Yes, we can start. Comparer for the day, you may begin now.
Good evening, esteemed guests, respected faculty member, and fellow students. It is an honor to welcome you all to this highly anticipated webinar on sports injuries and sports medicine, hosted by Indian School Baucha. Today, we have the privilege of exploring crucial insights into injury prevention, recovery, and the latest advancements in sports medicine with an expert in this field. Before we begin, let us commence this event with lighting ceremony and prayer, a tradition that symbolizes wisdom, knowledge, and the pursuit of excellence.
Yes, we may continue.
Up to you.
Miss Rehan, sorry, Mr. Rehan.
Thank you. Moving forward, it is my pleasure to introduce our physical education student, Ms. Sampriti Anand, who will deliver the welcome address and set the tone for this enlightening session.
Good evening to everyone present here. It is my immense pleasure and honor to welcome you all to this much awaited and insightful webinar on sports injuries and sports medicine, hosted on this wonderful platform of Zoom today on 24th April of 2025. On behalf of the organizing committee, I extend a warm and heartfelt welcome to all dignitaries, esteemed guests, and participants joining us today. We are deeply honored to welcome our esteemed resource person, Dr. Yogesh Chandra sir, a distinguished academician and sports educator. Dr. Chandra sir presently serves as a professor and dean at the Institute of Teacher Training and Research University of Haryana, Soniapet. Sir, we are truly privileged to have you with us. Your expertise and deep knowledge in this field of sports and medicine and injury prevention are of immense value to our audience today. We look forward to learn from your vast experience and researches. I would also like to extend a warm welcome to our principal, Mr. Peter Bakaran, sir, our visionary leader whose constant encouragement makes us an academic initiative possible. A special welcome to our Vice Principal, Mrs. Ambika Padmanabhan ma'am, whose dynamic leadership always ensures smooth execution of our programs. My sincere welcome to the Head of Physical Education Department, Mr. Ajay Singh sir, and all our dedicated PE faculty members whose enthusiasm and commitment to promoting sport and well-being among students have been truly commendable. A warm welcome to our students, the future torchbearers of the sporting world, and the parents who have supported and encouraged their children in every endeavors. Today's webinar aims to shed light on crucial yet often overlooked aspects of these sports: the prevention, the diagnosis, and treatment of sports injuries, along with the broader understanding of sports medicine. Whether you are an athlete, coach, teacher, or a parent, today's session is bound to be enriching and eye opening. Let us all make the most of this opportunity to expand our understanding and build a safer, healthier environment for the sports and physical activities. Once again, I welcome you all and thank you for being a part of this session. Let us now begin the webinar with enthusiasm and curiosity. Thank you.
Thank you, Sampriti. Next, we will hear again from our physical education student, Ms. Richa Aji George, who will share the distinguished profile of our esteemed guest speaker.
Dr. Yogesh Chandra, a distinguished academic, volleyball coach, and researcher, is an assistant professor and head of the Department of Physical Education at BPS Mahila Vishwavidyalaya, Haryana, India. A national gold medalist in volleyball, he holds a PhD in physical education from LNIPE, Gwalior, and has 18 years of teaching and coaching experience. His remarkable career includes publishing 24 research papers, editing 2 books, contributing 11 chapters, and guiding doctoral students. He has chaired and attended over 50 national and international conferences and workshops worldwide, including in Canada, USA, Israel, Russia, and Japan. Dr. Chanda is a subject matter expert for physical education MOOCs at NCRT and has contributed to SWAYAM, MOOC modules, ARPIT courses, and inclusive education videos for Haryana's Higher Education Commission. He played a pivotal role in designing curricula for multiple physical education programs at BPS, Mahila Vishwavidyalaya, and other universities. Previously, he served as a volleyball coach at Motilal Nehru School of Sports, producing national medalists and international players. His interests include coaching volleyball, research, digital pedagogy, adapted physical education, and Olympic Games. He is an examiner for various universities and holds influential positions in academic boards and syllabus committees.
Thank you, Richa. Now, the moment we have all been waiting for. It is my great honor to introduce our guest speaker, Dr. Yogesh Chandar, Professor and Dean School of Physical Education and Sports University of Haryana, Soniapat, India. With his expertise in sports medicine and injury management, Dr. Chandra sir will lead us through our today's webinar, providing valuable insights and practical strategies for athletes, trainers, and medical professionals alike. As we begin, let us remember the words of Vince Lombardi. It's not whether you get knocked down, it's whether you get up. Injuries are inevitable in sports, but it is the resilience, preparation, and medical expertise that ensures athletes rise stronger than before. Over to you, sir.
Thank you, Sampriti and Richa, for elaborative introduction. And I'm grateful to the school, Indian School at Posher, for giving me this opportunity to have interaction with you. I hope my voice is clearly audible to you.
Yes, sir.
Okay, thank you. Thank you. And I'm
Yes, sir.
also thankful to Madam Manju, who always connect to me and convince me for lecture. So even although I speak on research, sports training, but although this was a area quite, I would say, uh, I'm not saying that this is not beyond my reach, but yes, I have a basic sense of what exactly injury prevention is, what prehab and rehab is, and what is the role of sports medicine in injury prevention, and how athlete once prone to injuries can avoid injuries, and if it occurs, how which protocol that athlete will follow to go ahead with that injury management system. Okay. Please let me know if you can see my presentation. Just a
Yes,
minute.
sir.
Yes, sir.
Yes, sir.
I hope presentation is visible to you.
Yes,
Yes,
sir.
sir. That's very clear.
Thank you. Just a minute. Let me. Okay. Fine. So what exactly, let me update for myself. Right now, I'm working as a professor in Sports University of Haryana. I think Richa took up my biodata from my earlier university where I used to serve in 23. But right now, I'm working with the Sports University of Haryana. Let me give the brief introduction of this university. This is the youngest university as far as sports education is concerned. Right now, we have 450 students and target is to 750 students this year. And if we are able to achieve our target, so this would be our third largest sports education university in India with 26 program and 750 students. And within a span of 1.5 years, we have received affiliation of UGC, Association of Indian Universities, and our PG diplomas are equivalent to like NIS, Patiala, and or related centers. So this was all about my university. This is a state university. You can say a government university. So let's discuss the topic that is assigned to me, that is sports injuries. So injuries may occur anytime, whenever you are prone to activities, when you are doing exercise, when you are doing sports movements, when you are performing sports skills, when you are physically active, it may happen anytime. I mean, it is uninvited thing which happened to you. But yes, with certain precautions, with right kind of treatment, you can cure it well, and you can once again join the sports that you are missing or you may miss due to such injuries. And one of my colleague used to say when I served this Motilal Nehru School of Sports, right? As a volleyball coach, he used to say that, okay, the sports injuries are the ornaments of athletes. So it is very obvious whenever you will have certain physical activities, high intensity activities, you are all prone to injuries. So why this topic is important, why you need to understand that what exactly sports injuries are, why knowledge is crucial for you. uh, I think everybody must have, whether he is athlete or non-athlete, must have a basic idea of sports injuries. Even coaches, trainer must ensure the safety and long-term athlete performance, and if they can do so, if they have at least a basic idea of preventing and rehabilitate sports injuries. Okay, there may be different causes of sports injuries. I mean, sometimes training is not planned. Like when we mark some red zone, green zone, yellow zone, and so on. Like if your loading is not proper, uh, load is like how you define load. Load is something that disturb your normal functioning. Like you're sitting on chair, your heart rate is normal. Like I'm talking to you, or other people are sitting in virtual classroom. They have their breathing pattern is normal. Their heart rate is normal. Other vital functions are going well. So we call it state of homeostasis. And to what extent you disturb this homeostasis. For example, if you are supposed to run a 100-meter race with high intensity, so what will happen? Your heart rate will go high, your breathing is improper, and certain changes happen to your body. We call it load. I mean, you're disturbing your normal functioning. If that disturbance, because performance happens with load. If you want to perform good in sports, you need to take load. But yes, that load should be properly planned. If your load is not properly planned, it comes under the poor training practices. And as I have seen, you might be knowing about one of the Indian youngest marathon runner, Budhia. I think 10, 15 years ago, a man was in pictures. All you must have seen the newspaper and all. Okay, he started marathon very early. But where is Budhia now? Because his training plan was not properly built up, and ultimately, what happened? He entered into early burnout stage. And second, although there are hundreds of causes of injuries, but I'll not go into detail, but just to have a basic idea, and improper equipment, for example, if you're not wearing proper equipment, protective equipment, so you may cause injuries. And third largest cause, I would say that is the largest cause, because lack of conditioning and warm up. If you're not properly conditioned, if you're not properly warm up, you're always prone to injuries. So this is the major cause of injuries in Indian athletes. Sometimes they are not conditioned well, and sometimes they skip warm up, and as a result, they land into injuries. Fatigue and overuse injuries are also very common when you're ignoring recovery, and that also lead to injuries. Accident and collision, this is something you can't control, because other conditions you can control, but yes, accident can happen anytime, even if you have n number of uh, yes on terms and condition, but accident can happen anywhere. So this is something that is beyond your control. So let's start to understand the classification of sports injuries. If I classify injury on the basis of nature, so you can say injuries are acute injuries and chronic injuries. Acute injuries are like sprain and fracture, which occur suddenly. Okay, you are playing a football and you fall down, and okay, fracture happen and sprain happen, and it may happen in other games also. This is a one-time injury, and it can happen anywhere. So second type of injury is chronic injuries, like you dwell it with over a period of time with repeated motions, like tendinitis, like stress fracture. Uh, if I go through, I hope my voice is clearly audible to you.
Yes, sir.
Okay, thank you.
Yes,
So
sir.
next type is, like, if I talk in terms of injuries, like you can classify it in soft tissues injuries, like bruises, sprains, strains are soft tissues injuries. Fracture and dislocations are hard tissues type injuries. And shin split, tennis elbow, this is a overuse injury. And third is skin injuries, like abrasion, blisters, lacerations, and all. So this is a broad idea of injuries that you can classify into different categories. Okay, suppose why injuries happen and how you can prevent injuries. So there are two. I would like to say that physiotherapy function on two particular, I would say, uh, cardinal principles. Those cardinal principles are, one is prehabilitation and second is rehabilitation. Okay, let's try to understand what this prehabilitation is. And prehab, sometimes we call it, or in journal we call it prehab. This refer to preventive training type approach that reduce the risk of injuries before it happen. And it is customized program of exercise and routine designed to strengthen the muscle and improve mobility, correct imbalances, and before they cause injuries. So basic idea is this is a preventive type of measure that you can take, and you can avoid injuries, you can say. So this is a protocol that will help you to reduce injuries, that will help you to keep yourself away from injuries. So, okay, why this prehab is important? Let's try to understand this. It prevents you from acute and overuse injuries. It enhances muscular balance, stability of joints. It improves flexibility. It improves coordination. It improves body mechanics, which are required to perform certain movements. And if I talk in terms of prehab, so this support a long-term athletic performance. Like if you want to go a long in sports, or you want to have a longer career in sports, if that is only possible through this prehab protocol. And this also reduces the downtime due to injuries. Your resting period is reduced if you are properly prehab. Okay, okay. What are the components of prehab? Let's try to understand. So I would say that it includes a variety of activities. The first is mobility work. For example, if I focus on shoulder, ankle, and spine, if I use foam rollers, dynamic stretches. Okay, there are two things I would say. How many of you are clear with stretch and stretches? Stretching. Do you know what is stretch and what is stretching? Say yes or no.
Yes,
Yes,
sir.
No
yes.
one. Yes. Okay. See, kids, stretch are which we do before activities. Before activities, like for example, I was talking to a physiotherapist, and he said, "Okay, you can go with stretches before activities. It may be the part of your warm up. Like for example, okay, if I stretch my arm this way and hold it for 3 seconds, it is a stretch. And if I keep on doing this particular holding for let's say 30 seconds or 40 seconds, what will happen? My muscle tone will loosen with that, and that is not required before activities. So as a kid, you need to understand that what stretches are. So whenever you go for a stretching type of exercise before activities or use foam roller, you must ensure that stretch is not beyond 3-4 seconds. If stretch go beyond 10 or 15 or 20 seconds, that has a negative impact on muscles, because muscle, if they are in a tone, they will lose its tone. So this is a mobility type of work, is one of the part of a prehab program. Second is stability and balancing training. Like one, there are different type of balancing training. I'll not go into detail. You can have idea through YouTube, but yes, you can have balance boards, core strengthening like planks, anti-rotation drills. Then you can strengthen weak areas. For example, you can strengthen the underused muscle, imbalanced muscle group. So that I have seen new kids, okay, they want to grow their muscle and they'll focus on biceps so that they can fold their shirt and have a better look, or to show their sometime body image also play important role. And especially the teenagers, the school kids, they're very enthusiastic to show their body. So but what happens if they do some antagonist movement, like in term of arm flexion? They I think maybe due to lack of knowledge and so on, they forget to train antagonist muscle. So the balancing of strength is very important as far as prehab is concerned. There are bigger muscles like glutes, rotator cuff, hamstring, scapular muscles. Why I'm saying glutes? Because glutes is a powerhouse. Even if you throw a javelin, glute is involved in that. If you throw a discus, glute is in that. So this is called the powerhouse of the body. Like nuclear is mitochondria is the powerhouse of the cell. Okay, third part of prehab program must include neuromuscular control, like the communication between brain and muscle, and that happens especially with certain type of drills. When you expose student into different free lance activities, when student enjoy activities, and most important part of prehab is the fun component of physical activities. Why a person would like to repeat a behavior that create fatigue? It is only when a person will enjoy that activity. So component, and this is my appeal to all physical education teacher. The fun component, the activities that create happiness, that create fun, the student like to repeat those activities again and again. So whenever you plan neuromuscular control, yes, please.
Nothing, sir. Please continue. Maybe by
Okay.
mistake with some student.
So brain muscle communication is important, and this happen best. The age of this brain muscular communication is 8 to 12 year of age, the initial year of age. That's why when we talk, if you see the different training programs, they ask you to involve kids into different variety of activities. They don't focus on specialized type of activities. So neuromuscular control also drills involving reaction time, proprioception. So these are the activities that you can have in neuromuscular control, and sports specific drills. Like you can follow certain patterns, you can have some readiness drills or actual type of performances you can do through in prehab programs. So when you need to perform this prehab program, okay, what is the right time? Okay, when there is an off session or there is a pre-session training. For example, if I'm entering into a microcycle or a mesocycle, so I can start this from transition period. So there are, I think, physical education teacher. I don't know whether you have an idea of periodization. There are three major component of periodization. One is preparatory period, second is competitive period, third is transition period. Usually, you do this in transition period or pre-session, like before activities. Before returning to play or post-injury, you can use this prehab, because directly entering into mainstream sport can once again, I would say, was that injury that occurred due to the sports movement. As a part of regular warm-up program and cooling down routine, it is very evident from the researches, if you have a good cooling down, you reduce up to 40% of lactic acid that cause fatigue. It means you will recover fast if you do a good type of cool down. And recovery is very important, dear kids. Let me tell you, when we talk of sports, we always talk of training and exercises. We forget the right kind of nutrition and sometime recovery. Even people, those who are following, let's say there are 24 hours in a day, and after 24 hours you train yourself for 4 to 6 hours. But yes, for 18 hours you are in a recovery period. If you don't plan that recovery properly, that can cause to injuries, that can cause to imbalances. And another type of application is when athlete is prone to specific reoccurring of injuries, then this prehab become very important. What happens with sports injuries? If athlete is injured and without proper rehabilitation, if he or she enter into sports, there are always chances of reoccurrence of injuries, and it happened. And that's why we always emphasize on athlete education. So this is, dear students, this is something very important for you that you need to learn. Peace and love. Earlier we used to call, okay, pricer is there, prevention, then rest, then apply ice, compression, or recommendation to doctor, pricer. But yes, I think in 18 or 19, this new type of protocol for rehabilitation is in trend. So this type of protocol is like, we call it peace and love protocol for injury prevention and recovery from injury. So one is protection. Avoid activities and movement that increase pain during the few days of physical activities. So one is you need to know your body, that okay, what you can do and what you cannot do. For example, if at the age of 45, if I'm a volleyball player, if I assume, okay, I was the gold medalist and same pace I can continue. So this is my foolishness. Until unless I'll not understand my capabilities, that whether I can play right now or not. So that may cause injuries. Second part of this peace and love protocol is elevation. So if injury occur, that you need to hire that particular limb from your heart as far as possible. So basic idea is to avoid the inflammation. If blood flow, the basic idea of elevation is to minimize the blood flow in that particular injured area. And third is avoid anti-inflammatory drugs. Earlier, what you used to say that we used to if a person is injured and feeling pain, okay, you give them painkiller, you do icing and all. So what happened? It is now proved by the researchers that one should not take anti-inflammatory medication, or you can say painkiller, that reduce healing of tissues. And how tissue heal? If more you can tolerate that pain, and due to the pain, what will happen? That will also have a vascularization of that particular area, and as a result, your blood flow will increase. So that's why we now recommend that one should avoid anti-inflammatory drug after having a injury. The fourth part is compression. If sometime and accidentally or otherwise while doing sports movement, if you are prone to injury, or if injury exactly happened to you, so what you can do, you can use elastic bandage or taping to reduce that inflammation or swelling. So compression is the best idea. Even earlier time in Pricer treatment, it was there, but yes, now it is recommended. And Madam Manju, I'll share this article with you. It is published by British Journal of Sports Medicine. That is the one of the prestigious journal of world, and you can find out the detailed protocol in that. And I'll also circulate this protocol to students. If they are interested, they can go ahead with this.
Sure,
And
sir. Thank you so
and
much.
fifth part is of peace and love protocol is that is education. You know your body best. You know when your body is paining. You know when to play. You know what type of activities you can do. So avoid unnecessary medication and avoid unnecessary treatments. Avoid unnecessary investigation. See, you will sense, okay, doctor can't sense where you are feeling pain. If my range of motion is here, if I stretch up to this particular angle, only I know that where it is hurting. Only bearer know where shoe pinches. The same way education of athlete is required. So this is one of the part of peace and love protocol. And what exactly love contain is loading. The load I have already explained to you, that normal dysfunctioning of the body happen with load. If you disturb your normal functioning of the body, it means I can say that you are loading your body. Load is let's pain guide your gradual return to normal activities after injury. Your body will tell you that what is safe for you, how much load you can increase, how well you can go ahead with load. That is the most important part. Like, for example, if I say, okay, what is loading exactly? So loading is I would say, most crucial part of sports training, and especially of rehabilitation. Those who are very good physiotherapists, they know how to load the body. Optimism is very important. Condition your brain for optimal recovery by being confident and positive. If you believe yourself that you will be fine, and if some injury happened to you, you'll recover yourself from injuries, so you will recover. No, nothing can stop you from recovery if you are optimistic, if you believe in yourself, if you believe in your healing system, if you are positive. So next part of protocol is vascularization. So vascularization is nothing just to increase the blood flow in that particular area for repairing tissues. Choose pain-free cardiovascular activities to increase blood flow. For example, if you have fracture in lower limb, you can activate upper body so that your blood is circulated and you get a faster recovery. I was reading about Djokovic. He got a injury before a major tournament, and within a few days he recovered from that injury. Everyone was surprised, and that happened with this protocol. And now throughout the world, people are following this protocol. And last not least of this peace and love protocol is exercise. Restore your mobility, strength. You should know that, okay, what type of recovery approaches are required for you. You should know that which exercises you can do. You should know that proprioception, what kind of proprioception by adopting an active approach is suitable for you. So this was all about love and peace protocol. I'll send you the PPT for the same. And next part is sports medicine. Sports medicine and sports. What is exactly the sports medicine? This is a branch of medicine that deal with fitness, that we deal with treatment, that deal with the prevention of injuries, and that deal with the exercises. You can't say that, okay, sometimes we are confused it with the medicine only. Sports medicine is uh, whosoever staff is required to minimize the recovery process, to expedite the healing. That is the part of sports medicine. And what are the goals of sports medicine? The first goal is how you can prevent yourself from injuries. Prevention of injuries comes under this particular goal. How we can promote safe and effective physical activities also come under the goal sports medicine. Enhancing athletic performances, another target that we achieve through sports medicine. Because getting a optimal or peak performance is not possible through the sporting staff. In detail, I'll discuss that who are those sporting staff. That'll also include physiotherapists, that also include psychologists, trainers, also, and all those associated staff, supporting staff, work together with coaches. Uh, when I talk in terms of sports medicine, how you recover fast, how you rehabilitate, why recovery is important. Recovery, as I said, in recovery, there are so many components. There is a component of nutrition. There is a component of, if you go through with elite athletes, in normal circumstances, what we used to study in school days, that there is a 21% of oxygen in the environment. But what nowadays athletes are doing, they consume 100% pure oxygen. And what happened as a consumption of that oxygen, there are number of recoveries. There are magnetic legs. You improve compression legs are also there, that you improve recovery through that. Now there are like pre-workouts are also coming, that you also improve recovery with that. Post workouts are also available in form of diet and all. But there are different practices also, like massage, cryotherapy, and so on. So sports medicine is also something that help you in recovery, that help you in rehabilitation. Once you're prone to injuries, and if you want to rehabilitate yourself, so this is the branch that can help you in recovery mode. Okay, how we can prevent injuries? even a few points I have already discussed. You can prevent injuries through proper warm up and cooling down. And this is the, I would say, biggest cause of injuries in sports, that we avoid or sometimes ignore proper warm up and cooling down. If your technique is correct, if your posture is correct, if you're following the principle of moment economy, if you are following the, like for example, leg, the joint of leg is made for flexion extension. If start doing rotation and abduction with this particular type of joint, it is very obvious that we will land into injuries. So correct posture, and you should know as a practitioner that, okay, what kind of activities or what kind of action can be performed through a particular type of joints. There are three type of joints. Usually we call it immovable, movable, slightly movable, freely movable. And freely movable further are classified into 6 types. We call it ball and socket, saddle joint, uh, condylate joint, pivot joint, hinge joint, and gliding joint. So one is immovable, slightly movable, and freely movable type of joints. If you know that which kind of activities can be performed at a particular posture, particular angle, particular joint, so you may reduce the chances of injuries. If you properly wear gear, you can avoid injuries. And other thing I recently came to know that hydration is the very important part. If you want to keep yourself free from injuries, you must drink 3 to 4 liters of water per day. So basic idea is like, if you see, like if a thing is not having moisture within it, it will bend down and break down. And things which have moisture in it, like a stick of tree, if it has a proper moisture, you bend that stick, once again it will be same. Elastic property is there. The same happen with our body. If our muscles are properly hydrated, if our overall body is properly hydrated, we can prevent ourselves from injuries. Same in case of nutrition. If you are consuming balanced type of diet, you can avoid injuries. And one thing that is very important, that sports performance is a product of exercises. It is a product of right kind of nutrition. And third and most important part of sports performance is rest and recovery. If your recovery system is proper, if you are taking right kind of diet, if you are taking doing right kind of exercise, there are chances, if you have a potential, you can reach at maximum height. That happen with this recovery process and rest process. Okay. When I talk about sports medicine professional, so who are those sports medicine professionals? One is physicians. Normally, we usually visit them in case of minor diseases or major diseases. Normal practitioner, those who are appointed in hospitals and all, usually those who look after patients. Second is physiotherapist. They are also part of sports medicine professional. And that those professional play very important role in rehabilitation. Third is athletic training, and you can say expert from strength and conditioning. He know that what kind of load we can give to an injured person. Next is nutritionist, who knows that what kind of diet is required. Earlier we used to say that, okay, if a person is having injury, okay, you give them more protein and they'll recover themselves. This is not a theory, especially after this introduction of peace and love protocol for rehabilitation. And last not least is psychologist. So everything function through your brain. If your psychologist is good, if he help you or she help you in proper rehabilitation, you can return to normal sports training or performance. And all these staff, sports medicine professional staff, they report to coach, because ultimately where athlete will play, he will play with coach. So there is, if I talk in terms of sports medicine professional, although the list is indicated as my left in sports physician and farmer and end with sports psychologist, but yes, all need to report to coach. Okay, what is the idea of physician, physiotherapist, trainer, psychologist, nutritionist? He will compile those ideas, and okay, ultimately, because athlete will train with coach, not with all these sports medicine professional. So everyone, those who are participating in this type of activity, they need to report to coach. So thank you with this presentation. I hope I got 45 minutes and 5-7 minutes. I would like to address question, and accordingly I'll finish. That's all with my presentation. If you have questions, you can ask me.
That
Good
was
evening,
truly
sir.
insightful. Thank you, sir, for sharing such valuable
Uh,
knowledge. Now we move on to
Manju, I'm sharing a PDF with you. You can share this PDF to your students. It will help them to understand the concept of peace and love in rehabilitation process.
Sure, sir. I'll be taking care of that and I'll share with my students also. Students, you can write your questions in the chat box, so it will be taken care by Rehan. Rehan, you can continue.
Madam Manju, please see your WhatsApp. And
Sure, sir.
for students, I can type that in just a minute. Hmm. So I have shared soft tissues injuries simply need peace and love. So you can go through with that. So this is an article I was recommending you from British Journal of Sports Medicine. So, and where is this school, by the way? Because second time I'm appearing for this virtual presence.
We are in GCC countries, sir, in Oman, and
Okay.
we are from Muscat, and our school is Indian School
So
Bosher.
your school is in Muscat city. It is
Yes,
a
sir.
city or town?
Yes, sir. It's city.
City. So dear kids, next time I would like to visit your place.
Definitely, sir. You are most welcome.
Uh,
Our kids will be very happy to see you.
oh,
Uh, we are requesting students to fill, definitely please, the form, feedback form is also there, and your query you can write in the chat box. Rehan, you can continue. If
yes,
students have put up the question, you can ask, please. Continue.
yeah. So those who are watching from YouTube, it's there in the pinned comment section. So you can fill the feedback form from there. So there's a question in the chat from Aliza.
specific to their physiology. Uh, managing injury specific to their physiology. See,
When I
managing
read it for you.
injury doesn't have any specific concern with gender. Either you are male or female, because see, the process of recovery is same for male and females. And let me tell you very frankly, the training is same for male and female. We don't discriminate, okay, this is a training for male and this is a training for female. uh, so like like emotions are same for all. If a person feel happy, happiness remains same for male and female. Same in case of uh, rehabilitation. I mean, the protocol is same. Okay, Aliza, I hope I could answer your question if it is understood by me. Good evening, sir. What be the mental state and mindset of a lead during the recovery process? Yes, see, dear kids, what happened? See, when you are at peak, so there is a glory associated with performance. You feel happy, you are very high spirited, and that's why there is a Olympic. Have you heard about the Olympic living syndrome? No. Digesting success is very important. Once you are a successful athlete, everybody prays about you. They want to have a selfie with you. But once you are injured out of grounds, you'll see the entire scenario change for you. So yes, the mindset of injured athlete uh, play a very important role. That's why in sports medicine, if you see in list, there was a psychologist. I would say that those who are good resilience, those who can bounce back, can actively rehab. And this is the success mantra for, I would say, as a physical education teacher.
Good evening, sir.
Evening.
Sir, my name is Sayyid Ayan. I'm a physical education student of grade 11, and I would like you to brief us about ACL injuries, how to recover from them, and how long it takes to heal properly.
ACL is, I mean, this is a very crucial injury. See, anterior ligament, for example, if it tears, for example, it depends what kind of tear you have. If it is a grade 1 and grade 2 tear, so you can recover with rest and recovery and strengthening exercise, it is fine for you. But in grade 3 tier, in case of ACL, it once again depends that what kind of injury it's, whether you need a proper surgery when you can. But yes, in grade 3 it is completely ruptured. In grade 2 there is a less strength. There is a injury. There is a minor injury. But yes, with strengthening it will recover. But grade 3 is like it is apart. The tissue is completely broken, and the only treatment of ACL is that is surgery. What happen? They will make insert a rod in your hamstring, or it depends upon the decision of doctor. But most of the time they create it through muscle, hamstring muscle. They make a new ligament and place that ligament in both bones through screws. And with passage of time, what will happen? They grow with muscle, and ultimately a person recover from that. But yes, in grade 3 ACL injury, you need to operate it. I hope I could answer you.
Yes, sir. Thank you.
Sir, I have a doubt, sir. It is
Yes, please.
similar to the question of Ayan Hamid. Sir, if a person is seriously injured or is very severely injured and is not unable to come out of the trauma, how would we help and how would we motivate them, sir? How would we psychologically help them?
So that's why I said that in team of sports medicine, psychologist is there. There, they have specific strategies. They have certain protocols, and according to person, because it is highly individualized. You can't say a single model fit for all. So it depends that what kind of a psychologist will do assessment first, and accordingly plan a rehab psychological intervention for that particular athlete. So it is highly individualized type of program. There is no common type of program as far as athlete seriousness is concerned.
Thank you, sir. So there are two more questions in the chat.
Okay.
Um,
Yeah.
so someone asked, how do I know if my injury is serious or if I can just move on with it?
Okay. See, as I told you that our body is an indicator. Like, for example, if you are feeling pain, so what kind of pain it is again? Like if it is, I mean, very light pain, fine, it will subside with passage of time. But if that pain continue, this is alarming sign. First thing. Second thing is you compromise flexibility and mobility. That is the second sign. And third sign is you're not performing that activity properly. For example, if I play volleyball and if I'm not able to jump properly, that I should understand that something is wrong with my body and I need to visit doctor. So your body start, I would say, giving signal to you that, okay, this is the right time that you should visit to doctor. There are 2-3 signals. One is pain, second is mobility, third you lose flexibility, fourth you are not able to perform that exercise or particular type of motor skill with 100% of effort. It means there is something wrong with you.
Thank you, sir. So
Also,
there are
sir,
two.
how do you know if you are overtraining or not doing enough? Okay. So it is entirely, I would say, individual kind of question. So there are people, those who can tolerate lactic acid, because lactic acid cause fatigue in your body. There are, in case of tendinitis, patellar tendinitis is like you feel pain of that. Okay, that particular type of tendon start paining and you have a prolonged pain in tendinitis. So, okay, there are, I hope I'm mixing two questions. Okay, let me answer first overtraining. So what will happen in overtraining? One thing is that you will feel dehydration. Your skin become pale and your body take more time for recovery. You are not comfortable. Sometimes those who are overtrained or overload, they may be irritating type of persons. Even their behavior is changed sometimes. So it is entirely a subjective question, and those who are experienced coaches, they can understand that their athlete are in load and they need a right kind of recovery and they are doing overtraining. And once again, if your load is progressive, if your progression of load is proper, so I can say that because what will happen, the road will not occur abruptly or you'll not enhance load directly. So if it is progressively enhanced, you can say that, okay, I am in a proper shape or training and my training is going in right direction. But yes, if you feel fatigued, if you are not feeling well, sometimes nausea symptoms are there. Even sometimes what will happen with you, sleeplessness is also there. If you do overtraining, you'll not sleep properly, so you lose sleep. So there are so many symptoms and it is a highly individualized type of question. Okay, I think experienced coaches, they know that how to identify this overtraining. And next question, how could I recover from patellar tendinitis? Okay, see, you need to rest. I have already given the protocol to you in terms of that article. You go through with that article, you'll understand that what is the process of recovery, what steps you need to follow, 1, 2, 3, 4, 5. Okay, so steps are given there. You follow those steps. You consult doctor, because see, I'm not a medical practitioner, but yes, I can give you a general idea that, okay, if you're feeling tendinitis, okay, fine, you go and have rest, you go have active rest. For example, there you need to, as I said, that you need to enhance a blood supply in that particular area. For example, if my patellar tendonitis is there, what I can do to improve blood flow, I can do exercises of upper body. I can give rest to that particular leg, and other leg I can move. Different body parts I can move. What will happen as a result of movement of those body part? The blood circulation will be there in my body, and automatically that particular part will heal. I hope, Sharon, I could answer you.
Yes, sir. I think no more questions. If any other questions are there, I am requesting students to forward these questions to us, either me or Raja sir or Tyagu sir, whoever number you have approachable, and we will forward these question definitely to Yogesh sir. Don't worry. And now we will go further, not to take too much time of Yogesh sir, as he had continuously from 4 past days back-to-back meetings. So we appreciate he took time for us.
Actually, as
So
a dean, you have less teaching and more other assignments.
yes, we understand that, sir, and thank you for giving your precious time, sir. Now, Rehan, we can continue.
Yes.
Further queries can be shared with me, and definitely it will be answered by Yogesh sir. Don't worry, I will forward all the query to him.
Thank you, sir. Finally, to formally conclude this event, I invite Mr. Ajay Singh, Head of Physical Education Department, to deliver the vote of thanks. His words will express our gratitude for the efforts that made this webinar possible. Over to you, sir.
Thank you, Rehan. Good evening, everyone. It is my privilege and honor to deliver the vote of thanks at the conclusion of today's insightful webinar on sports injury and sports medicine. First, uh, First and foremost, I extend my heartfelt gratitude to our esteemed speaker and expert who started their valuable shared with their valuable knowledge and experience with us. Your input have not only deepened our understanding of sports related injuries but have also highlighted the importance of proper prevention, care, and rehabilitation, pure aspect of the well-being of sports athletes. A big thank you to organized committee and the technical team for their seamless coordination and effort behind the screen. Your dedication make this online session smooth and engaged for all attendees. To our respected school management and administration, thank you for your constant support and our recognize the importance of sports medicine as an integral part of the student development and safety. Last and not least, a warm thank you to all participants, teachers, coaches, parents, and students for your active involvement and keen interest. Your presence and enthusiasm made this session meaningful and successful. Let us take forward the knowledge we gained today and implement it in our school to ensure the healthier, safer environment for all our athletes. Thank you once again and Shubhratri.
Thank you, sir. With that, we conclude today's webinar. Thank you all for your participation, enthusiasm, and engagement. As Billie Jean King wisely put it, champions keep playing until they get it right. May the knowledge gained today contribute to safer, stronger athletic journeys. Wishing